In Northeast Ohio, you know we are known for world-class medicine, not just in care provided, but advances in research and development. You might be wondering, how did we get here, though?
Yeah, much of it has to do with the Academy of Medicine Cleveland in Northern Ohio. The nonprofit medical association began exactly 200 years ago.
Senior health correspondent Monica Robbins takes a look at how it all started.
The Academy of Medicine Cleveland and the Northern Ohio Medical Association began as the 19th District of Ohio in 1824, the first professional medical association in the state and one of the oldest medical organizations in the country. 5 physicians attended the first meeting, not surprising since Cleveland didn't even have a hospital. But it didn't take long. A cholera epidemic erupted in 1837, giving birth to the city's first infirmary, formed by 28 doctors who worked without pay. Today, you know it as MetroHealth. In 1866, civic leaders, not doctors, decided to form a second hospital and help the less fortunate. Wilson Street Hospital opened in 1868. Today, you know it as University Hospitals. In 1921, 4 doctors who were war veterans founded Cleveland Clinic, treated 42 patients on their opening day. The hospitals grew and changed as quickly as healthcare, and while they became the region's leading employers in later years, the contributions of their doctors saved millions of lives, suffering from thousands of problems. Cleveland's impact on polio helped eradicate the disease. Dr. John Toomey identified how it invaded the body through the gastrointestinal system. Dr. Frederick Robbins won the Nobel Prize for growing the virus in a test tube, which paved the way for Jonas Salk to invent the polio vaccine. In 1961, Dr. Albert Sabin of Cincinnati developed an oral version of the vaccine that lasted longer with stronger immunity. The Academy of Medicine organized a mass vaccination program known as Sabin Oral Sundays and vaccinated nearly all Cuyahoga County residents, at the time considered the best record in the United States. Local doctors led the way in discovery and treatments for rheumatic fever, tuberculosis, limb transplantation that eventually led to the first face transplant. Mechanical limbs, the precursor to bionics, and our doctors revolutionized heart care. In 1933, Dr. Claude Beck successfully removed the first heart tumor, and 2 years later did the first coronary artery disease operation. He was the first to do heart defibrillation and helped develop what we now know is CPR. The K-Cross oxygenator kept patients alive for open heart surgery, and thanks to industrial Cleveland, was mass-produced for surgeons around the world. In 1958, Cleveland Clinic doctors discovered coronary angiography and got their first look inside arteries. 9 years later, they did the first bypass surgery. Our medical systems were forerunners of desegregating hospital care and including women. The lists of firsts and innovations easily fill the last 200 years, and today we're doing even more. The Academy is ready to guide the next generation of physicians who will change the medical landscape once more. Monica Robbins, 3 News.